The Air on Foam dynamic cushion is an 18-inch dynamic pressure therapy cushion with a maximum user weight of 120 kilograms, which is 17 stone, and this assists with the provision of 24-hour pressure area care planning. The cushion is suitable for up to very high-risk patients, however, always ensure monitoring and repositioning is carried out as per the individual plan of care. A risk assessment must be performed to ensure the suitability of the patient and the contraindications for use. Clinical judgment is to be used to determine suitability. Please refer to the full user manual instructions and guidance prior to using the product in relation to safe use. Seating used can vary greatly depending on the specific healthcare setting, so it is the responsibility of the prescriber to carry out the necessary risk assessment to ensure suitable product compatibility and the safety of the patient. Please refer to your local policy and guidance on equipment selection. To set the cushion up, position the cushion onto a fixed chair which has a padded seat, with the top cover facing upwards and the umbilical cord at the rear corner of the seat for pump unit positioning. Place the cushion with the front symbol at the front of the chair. Attach the straps to the chair, making sure they are not twisted and are attached securely. Position the chosen pump unit, the Theia or the Eros, onto a firm surface or securely suspended as assessed as suitable within the environment it's being used. Attach the umbilical cord using the quick connector by aligning with the ports on the pump unit and pushing into place. Attach the pump power lead to the mains power outlet, ensuring the mains cable is positioned to avoid it being a trip hazard. The cushion will then start to inflate. Inflation will be complete within 40 minutes. To optimise the maximum inflation time, you can turn the pump unit pressure to max and then reduce the pressure setting to meet individual clinical requirements. The umbilical cord connector includes a transport cap, which means the cushion can remain inflated for up to 8 hours. This ensures the cushion provides pressure redistribution in any power outages. The dynamic Air on Foam cushion has a green top cover, which is multi-way stretch, waterproof and vapour permeable. Ultra Fresh, an antimicrobial agent, is fully encapsulated into the cover to help control microbial deterioration and to help extend the life of the cover. The cover clearly identifies the cushion type and size. It identifies the maximum weight, which is 120 kilograms, and the care and cleaning instructions. There is also clearly identified the compatible pump units, which is the Theia and Eros, and there is also a front symbol for correct positioning on the chair. The cushion has a 270-degree zip and a white inner substrate on the underside of the cover. This helps auditing procedures by making staining easy to identify if the cover has been compromised. High-frequency welded seams and a fully concealed zip reduces the possibility of fluid ingress and aids infection control. The cushion operates on a 1 in 2 cell cycle over a 12-minute period, and this ensures that 50% of the patient's contact area is supported, whilst the other 50% experiences pressure relief. With 6 alternating cells providing pressure relief to the sacral and ischial tuberosities, a pressure-reducing foam base, side formers and front provide additional support and forward stability whilst seated. And just to note, any coverings should be fitted loosely to reduce a hammocking effect, and consider that any additional layers between the patient and the support surface, for example incontinence products, will impact on the pressure relief provided.